All right, good morning. Welcome and thank you to tuning in to Health Watch. I'm Dr. Victor Politi, the president and CEO of New Health, the big hospital on Hempstead Turnpike in East Meadow. Anyway, as healthcare in America is changing, New Health is part of that change. This half-hour program will provide you with essential information about our services and facilities that provides top quality care that fits into your lifestyle. You already know Nassau County's premier Level 1 trauma center. We have so much more to offer the community, including a full-service, state-of-the-art New Health Center of Care in Nassau County, a Holly Patterson Extended Care Facility, and the New Health Family Health Centers. Our improvements are making us a leading provider of primary and tertiary care services that rival the best in the country. Today, we're here, and we're lucky to have with us the Commissioner of Health for the Nassau County Department of Health, Larry Eisenstein. And Larry, good morning and welcome to the show. Why don't you start off by telling us a little bit about yourself, your background, and your training?
Yes, thank you, Vic. It's a pleasure to be here. As the Nassau County Commissioner of Health, I'm in a lucky position to have done all of my medical training in Nassau County. I'm board certified in infectious diseases and internal medicine. I did both of my training, internal medicine and infectious disease, at Winthrop University Hospital. I spent a year as chief resident in Winthrop, and that gave me a good administrative background, especially that year we had a joint commission visit. So I got to really learn a little bit about hospital and health administration, and it kind of pushed me towards this. After graduating my fellowship in infectious disease, I worked as an infectious disease doctor and did work with HIV and STD, and then in private practice, which ultimately led me to the Ryan White Planning Council for Long Island. The Long Island, Nassau, and Suffolk as a whole is one federal Ryan White region, and we share millions of dollars a year among not the counties but the agencies that serve the residents in our counties. And through that, I got to work with the Commissioner of Health in Nassau County then, and Dr. Carney. And before long, I became Deputy Commissioner, and then the opportunity to become Commissioner came, and here I am 3 years later as Commissioner of Health.
That's great. I mean, that's a huge responsibility. I mean, you basically are responsible for the health of everyone here in Nassau County, making sure that programs are in place for preventive medicine, for watching what we eat, and just about it's a huge responsibility. So why don't you tell me some of the things that the department does and what your day consists of?
Yeah, it's a funny question. A lot of people really don't realize the scope of the activities that the Department of Health takes part in. Some people think of the Department of Health as a place that's responsible for restaurant inspections, and that's certainly something that we do, and an popular area of discussion. Seems wherever I go, people want to know what are the safe places to eat and where not to eat. But that's one thing that we do that we're very proud of. We keep our food restaurants safe to eat at, but we do so much more. We oversee the water supply, the safety of the water in our county, and that gets there's a lot of talk and publicity about that. And the fact is, we do approximately 250,000 water tests a year, and so when people go for a cup of water out of their faucet, a lot of work has gone into making sure that it's safe, and people very often take it for granted. And we like to remind the public how much work goes into making sure the water's safe. We do the entire maternal child health response with regarding our early intervention and preschool program for children, identified either by families, pediatricians, schools as having delay, and our budget for that is close to $200 million, and we're very proud of the agencies that we have that provide fabulous services across the board to our children, and we know that getting them into care early leads to better outcomes. We have a very vibrant emergency preparedness bureau, and they train year-round. They oversee our Medical Reserve Corps of volunteers. Our Medical Reserve Corps is over 900 medical professionals right now. It's one of the largest in America. Medical Reserve Corps is made up of volunteer medical professionals ranging from physicians to EMTs to veterinarians, pharmacists, and we do training exercises. And when something like Hurricane Sandy happens, we activate them, and they helped out with our special needs shelter. But the Public Health Emergency Preparedness Unit which has a very large bioterrorism grant, spends a lot of time ensuring that our residents will be safe from a health standpoint should something like Hurricane Sandy or a man-made emergency occur. And we do a very large job in communicable disease control, which is pretty much how health departments began. In 1938, when the Nassau County Department of Health was first created by charter, it's interesting, the majority of the employees at the health department were veterinarians, and their job was to inspect the cows at the then 123 dairy farms, because a safe milk supply was one of the most vital components of life in the 30s. And now we don't have any veterinarians, but we still do communicable disease control. Our communicable disease team handles most infectious disease positive lab results. The majority of them are not serious, but we do have to investigate, inspect, make sure that every single one is addressed. There were more than 30,000 lab reports that were addressed in 1 year last year. Separate sections within our department oversee Bureau of Tuberculosis Control, which is a highly communicable disease that we're highly funded, and we have to do directly observed therapy. Every tuberculosis case in our county, we go and watch them take their medicine every day, and that's a CDC initiative. We have under communicable disease control, we have a Bureau of Immunization, which they do a great job of ensuring that our providers are working appropriately, and essentially we work with them to make sure that children get the proper immunization so that they can go to school and don't get other people sick. And we have a large STD HIV unit. They do a tremendous job of minimizing disease. We don't have that many cases, but certainly we think our efforts leads to decrease of disease transmission in that realm as well. And overall, we have about 250 employees. Certainly, what I just discussed was not comprehensive of all the things that the health department does, but just to give an idea of some of the general work that we
Sometimes
do.
I see in the summertime the beaches will be closed. Do you also monitor beach water?
We do. Part of our Environmental Health Bureau, which is very large, approximately 100 employees, does some year-round work, including restaurant inspections and water safety and engineering plans. Any corporate structure, any building that's going to be used for business, and any new residential dwelling that's going to have multiple units, our engineers have to approve the water and sewage plans. And we have a lot of seasonal environmental health work, the two most common being beach water testing, and we sample all of the permitted beaches. And what I mean by that is a public beach that has a lifeguard requires a permit. We test the water all summer long, from even before Memorial Day till around now. We're just wrapping it up, and we don't want people swimming in a beach where we have a lifeguard to tell them that it's safe, so they feel comfortable, especially parents with children, yet there's a bacteria or something in the water to make it dangerous. So we're testing the water. There are some beaches historically we close after a heavy rain because we know by history that there's going to be an elevated bacterial count, depending, especially water beaches that are not an open ocean. Open ocean flushes very quickly with tidal cycles, but we have a lot of bays, and so we protect the water there. And of course, perhaps the number one topic that I get asked about more than everything else combined is mosquito control.
Okay.
And we have our seasonal mosquito control, which we work on our planning year-round. 2 years ago, we presented to the public our new Nassau County Mosquito Surveillance and Control Plan. I want to thank County Executive Mangano for his support in allowing us to do this. We presented it to the Nassau County Legislature, and we did some public presentations, and it won a National Model Practice Award. And so we thank you. One of four, and I got to give my employees credit. We have, in the last 2 years, we've won 4 National Model Practice Awards. That's more than any other local health department in the United States.
It's amazing.
And it's amazing that our staff continues to produce incredible efficiencies and initiatives to come up with new modern ideas. And our mosquito surveillance and control plan is, as a model practice, we consider a gold standard product. And it started, mosquito control is something that public health has been dealing with for many, many years. And, At the beginning of the 20th century, in the early 1900s, people in America, in the United States, were dying of yellow fever in Louisiana and Mississippi and Florida. And so mosquito control is not new, but then a disease like West Nile virus appears, and it's a constant challenge and battle. So we're always updating our plans, and there really is a tremendous scope to what we do.
So you surveil mosquitoes and dead birds, and for West Nile as well.
Yes, we don't test dead birds anymore. The state health department has deemed that to be not a specific and sensitive kind of testing. But if there's a cluster of dead birds, we will work with the state DEC to figure out why. Certainly when West Nile, we know that birds are the natural host of West Nile. And we think that West Nile years that are more difficult, it's not every year that we have a lot of West Nile. Some years we see a lot of human cases, a lot being maybe 10 or 20. Some seasons like this one that just passed, we had very few, only a couple of human cases. And we think it has to do with the health of the birds, believe it or not. People think that because mosquitoes transmit the virus from birds to humans, the mosquito is the vector of transmission. People think that a rainy season where there's a lot of mosquitoes will be worse for West Nile. But what the trend's starting to appear is that rainy seasons, the birds are happy and healthy, and they're less prone to being sick, and we're actually seeing less disease transmission in rainier years as compared to dry, hot summers when the watering holes dry up, the birds may become weakened. This is all theory, but we only have since 1999 worth of data on West Nile. But we're starting to see a clear trend that the hotter, drier summers are worse for West Nile and mosquito control. So the science is still evolving even after all these years. And we have people who work on it and analyze the data. We have a whole quality assurance and research and epidemiology bureau that's taking all of the incredible data that we gather. And the New York State Health Department has its new 5-year prevention agenda. We've created a community health assessment and a community health improvement plan through this Bureau of Epidemiology and Quality Improvement and Research. And we intend to work with the state and all of our community partners, and I got to thank New Health and the other hospitals and our community agencies who came to the table to help us develop an appropriate community health improvement plan where the residents of the community told us what they perceive as the major health issues in the county, and we're going to be focusing, besides all of the daily work that we're mandated and that we do happily over the years, there's going to be an added emphasis on addressing childhood obesity and chronic disease, which includes diabetes and cancers, and that's what the public asked us to address, and that's part of our prevention agenda.
And that's really important. I think as physicians, one of the primary things we try to do, and I try to, send this message home on every show, is that if we could prevent something from occurring, that's our goal. Prevent a heart attack by watching your weight and your diet, and and eating the right foods, and stopping smoking, and watching your cholesterol and blood pressure. So that's very, very important. And I think you, as a public health commissioner, I think that's primary. One of the things that rises to the top is that you're right on the forefront of that battle of prevention.
Yeah, and what's interesting about it is it's hard to quantify something that didn't happen. So ideally, we're trying to prevent disease, but there's no way to count diseases that don't happen.
Right.
Certainly, we can compare initiatives and see what occurred with our initiative versus without our initiative. But so a lot of people ask me, as I was a practicing physician, do you miss the patient care? And I've become very comfortable with the fact that it's very different working in preventive health, where you're not going to have the patient in front of you to shake their hand at the end of the visit and wish them well, and sometimes they're grateful and sometimes they're happy. And in public preventive health, you have to be comfortable with the fact that the work that you're doing is going to save lives, and you're not going to have that moment to shake somebody's hand and see how we've been able to resolve a disease. But I think it's important to know that I believe that our efforts really save thousands of lives and injuries. But again, one of our challenges is asking for funding for initiatives and other things that we'd like to do when we know that there's no way to show what's not going to happen as a result of what we do.
But I think time has shown that the efforts of public health officials like yourself and programs really do make a big difference. I mean, we've eradicated some diseases
Yes.
because of the things that we've done in the public health arena.
Yeah.
And so, I mean, that's something that I think that it's a pretty well-known fact, and I think the support has to be there for Department of Health. And it's proven where counties have Department of Health, towns and cities have Department of Health and health inspectors, and it goes right up to the state level and to the federal level, where we always have to watch exactly, what's going on so that we could keep our citizens safe. But, the idea that we're physicians and we want to keep them, healthy on an individual basis never leaves us. It's just that
That's right.
your efforts are far-reaching, and you could make one determination that, won't just affect, one person. It'll affect hundreds of thousands of people. The age of smoking cigarettes, a seatbelt deregulation, or some other preventive measure that you might be instrumental in working with. So, we're talking about a lot of these surveillances in West Nile. And so, you're the Commissioner of Health, and you know what's going on right now in the media, and, the whole crisis, or this whole, the whole phenomena we're going through with Ebola
Yes.
right now. And so, I mean, you're on the forefront of this as well. So why don't you just give us a little, update on, today what's going on as far as as far as Ebola?
Sure, and I know that we've done some work together and presented to the press some of the efforts of New Health at Nassau University Medical Center, and I do think that before we get into some of the specifics, I think that you've said it very well. Hospitals have been dealing with infections for a long time, and so I want to be very clear that this is something that we, as a medical community, should be able to deal with. We've gotten great guidance now from the CDC, the State Health Department. I've spoken with Deputy Commissioner, a Senior Deputy Commissioner at the State Health Department numerous times on our needs, and guidance has come forth. We know that Ebola as an infection is something that we have to be prepared for. At any time, a patient may be able, with modern globalization, a patient may walk into any of our emergency rooms and present a risk for Ebola. And we just want to, as the health department, we just want to make sure and assist our hospitals and emergency rooms that they're prepared should this kind of patient come in. And so we're going to be hosting a meeting at the health department tomorrow of hospital executives and medical officers. We're doing public trainings for our first responders. Certainly that's where we have to put a little extra emphasis. We want to make sure we have volunteer fire and EMS in Nassau County. We want to make sure that all providers that enter a house have the safe means of addressing care for our residents. And that's where we're focusing our efforts. But I do want to be clear that the risk of Ebola right now for the average Nassau County resident is extremely, extremely low. And, I point out the data. We've had one death in the United States as a result of Ebola from a patient who traveled here. It was not endemic. It was not contracted here. And we're likely to have, on average, approximately 30,000 deaths a year due to influenza. So I do try and keep perspective where every year at this time I'm on my crusade to get people the flu shots. I have an appointment today for my own flu vaccine. But this year, of all years, it's really important because flu as a virus will present symptomatically very similar to Ebola. It's going to have the high fever, potentially the achiness, potentially the vomiting, potentially the other symptoms. Viruses in general very often mimic each other. And what we don't want, as flu season will arrive sometime in winter, as it does historically almost every year, we have no reason to think it won't, we want to minimize false alarms. If we get the majority of our population vaccinated against flu, they won't be showing up at the emergency room with influenza and setting off a potential Ebola alarm. So there is something that the average resident can do, which is prevent the false alarm, get themselves vaccinated, and while we're working on making sure that our first responders and hospitals have all the resources they need to appropriately deal with Ebola, and we do work with the CDC and the state should there be a case that needs to be in home quarantine or isolation. We follow them. We do the epidemiologic work when patients come in. At the same time, as I said, an average of 30,000 people die in the United States of the flu, and we want to try and really make an impact in that number as well.
So when we talk about the flu vaccine, that's a shot. They also have a nasal mist.
Yes.
The number one complaint you hear from people all the time is, doc, if I take every year I take the flu vaccine and then I get sick. I get the flu from the flu. Is that possible? Is there is that any truth to that?
Well, it's a question that I get. It's the number one reason that I'm given why people won't take the flu shot. And the fact is, the flu shot, not the spray, the shot is dead. And unless you're a big science fiction fan, you cannot get a live disease from a dead vaccine. It's not physically possible. With the live spray, which is proven to be more effective in studies than the shot, anytime there's a live vaccine, there's a minuscule possibility, but in the case of this, it's so weakened that the possibility of contracting the flu from the flu mist is bordering zero. And any child or adult with a normal immune system is not going to catch the flu. So it's not physically possible. What can happen, and what I think is often mistaken, is twofold. Number one, this is cold and flu season, and I think temporarily a lot of people catch colds in the fall around the time of their flu shot, and I think that they equate the two, which are totally unrelated, number one. And number two, there is the potential of an immune response to getting a vaccine. This could happen with any vaccine. So if somebody were to, when I get my flu shot today, if I'm a little achy and have a mild fever tonight or tomorrow, it's a positive sign that my body has recognized the vaccine and is attacking it, and a little bit of achiness and fever is a normal physiologic response. So that doesn't happen in most cases. In the few it does, we're not worried about it. It's, if anything, a positive thing that the body is showing a response to the vaccine. But to answer the question, can you get the flu from the flu vaccine? The answer is no. It's not physically possible.
Right, because that's it's, again, one of the things that you hear from people, particularly elderly persons, say, listen, if I don't take the flu shot, I don't get sick. If I take it, I feel like I'm having it. But it's just the temporal relationship of the time of year and the fact that you're going to get a cold,
Right.
But it's not the flu that has such a horrible outcome,
Right.
and is responsible for deaths every year.
Deaths.
And so, the other thing that we think about is pneummonia and the pneumococcal vaccine. And when is that recommended for patients?
Well, the new recommendations for senior citizens 65 and older, some of them have gotten it in the past, and certainly they should check with their providers if they're due. There's numerous scenarios, but you're right. We know that the pneumococcal vaccine, particularly with senior citizens, saves lives. And that's another example of, we're going to spend a lot of time in public health talking about Ebola, and there's been one death in the United States, and there's thousands of deaths due to pneumococcal pneumonia, particularly in the senior citizen population. So behind the scenes, we spend a lot of time working on where we really can make an impact on life and death. And pneumonia and flu are examples where I think that our work really does save a tremendous amount of lives. And again, we can't count that. We don't know what we're preventing, but we do know that vaccines have eliminated diseases off this earth. Smallpox, there used to be a 20% incidence of smallpox in the late 1800s. So, and of that, a large amount of people died, and it really is amazing that we've eliminated smallpox as a disease from the earth, and that's great public health work. And hopefully, one day the goal is to make that happen with the flu. Although Mother Nature is tough.
Yeah,
That's
absolutely. We've seen that with children with the H influenza, where we're able to vaccinate the children for H influenza, H flu, at childbirth, and that was one of the leading causes of meningitis and real severe respiratory disease and death in children.
Right.
And basically, we've just about brought that down to an unrecognizable number of cases now in the hospital from H flu. And so things like, if there's messages to get out to people, it's, get your flu shot. And we're not talking about to confuse you with Ebola. We're talking it's the right thing to do. It'll save lives. Elderly persons who have chronic or other comorbid diseases, viruses, need to get the pneumococcal vaccine as well, because that is a major cause of death,
Yeah.
particularly in the elderly population. Grandma, grandpa, they need to get that, pneumococcal, and they're not used to it. They lived, 80 years,
Yeah.
without getting these shots, and now all of a sudden we're telling them to get these shots. Well, my mother lived to 100, and she didn't get the
Yeah.
shot. But we have to refresh and make sure these patients get those types of prevention measures.
And not only that, there's a couple of facts. If somebody doesn't want the shots for themselves, particularly with flu, or for example, the tetanus booster, we know, thankfully, unlike Ebola, which is not contagious until symptoms onset, we know that influenza is contagious a full 24 hours before symptoms start. So think about it. Somebody can be walking around fully contagious with the flu and have no idea, and then sometime the next day, all of a sudden, it's going to be the flu onsets at once, like they were hit by a truck. In that 24 hours, while they may be young and healthy and able to survive the flu, how many people are they going to come across, transmit the flu,
Exactly.
who are going to get sick and die? And with the tetanus booster, we know that there's been pertussis outbreaks. We've seen it in our hospitals, and most adults, their airways are strong enough that the pertussis will just give them a little bit of a cough. But a baby who's not vaccinated can die from it. And so there's numerous examples where people getting appropriate vaccines protects not only themselves, but the people and very often their loved ones. So I urge people, think about it. Even if you don't want these vaccines for yourself, don't become a transmitter and get other people sick.
Yeah, it's true, and it can spread very rapidly. And speaking of viruses and schools and children, the enterovirus. We're seeing a lot about this enterovirus D68.
Yeah.
And is that a new invention, or how did this come about? Or
Well, enteroviruses have been around as long as we can remember. They're typical summer, fall viruses. There have been worse enteroviruses, and Nassau University Medical Center at one time was a very large polio iron lung hospital, and that's an example of a summer enterovirus. But this one is not like that as far as severity. Most enteroviruses, and in this case, enterovirus D68, what we would expect is for it to present like a typical common cold, the summer cold, the fall cold. But this one has shown a propensity to be worse, particularly with children who are asthmatics. It has caused exacerbated asthma and has led to deaths. And so with the typical common cold virus, this enterovirus, we just keep educating the public about how to avoid common colds and flu. Wash hands with soap and water. I tell my children all day not to touch their face, not to stick their fingers in their mouth. I have young kids, and they will eat a dessert with their fingers, and I nag them like they think I'm crazy. But the fact is, that's how flu viruses are, common cold viruses are transmitted: touching the nose, touching the eyes via the oral membranes, and so hopefully it will pass as the season changes. There'll be new common cold viruses that activate as winter comes. But D68 is one of the worst common cold viruses we've seen as far as causing asthma exacerbations. And children, and not only children, late teenagers have died. Not a lot of them, but yes, we watch this closely, and we've done a lot of education on this, and it's another thing to worry about.
So what should we do, Dr. Eisenstein, if we do come down with the runny nose, the cough, the fevers? Is there any suggestions as we end up the show for our listeners, and what they should have on their medicine cabinet, and what they should do for themselves?
Well, I think that if they're worried or concerned, they should call their medical provider. I don't want them running out to emergency rooms. I don't want people running to pediatricians' offices where they can give just a simple cold to everybody in the office. If they have a concern, they should call for guidance. With Ebola, certainly they can call their provider or the health department or whatever. But for a child with a typical virus, pediatricians are very usually able to make a good assessment of whether the patient needs to come in to be seen or not. Very often with a cold, it's just a matter of staying home so you don't get other people sick. We put out press release, and I want to thank the superintendents of Long Island, of Nassau County, for sending a letter home to parents. If your child is sick, please don't send them to school. End the mode of transmission.
And I think that goes not only for children, but for adults as well. If you're sick, if you have a cold and you have a flu, you have fever, stay home. Don't go to work, because you're going to wind up spreading it to everyone else in the office, and then everybody's going to be sick.
Exactly.
So stay home and rest, drink lots of fluids, and call your doctor and follow up with your physician if needed.
Yeah.
So, Dr. Eisenstein, what a really engaging conversation, and you really are a wealth of knowledge, and I'm proud to know that your number's in my Rolodex, that I can call you when I
Anytime.
have problems at the hospital. So this is Dr. Victor Politi from Nassau University Medical Center, New Health, over on Hempstead Turnpike. And thanking you all for listening today, and hope you all stay healthy and safe, and we'll see you in a couple of weeks. Thank you.